Controlled open enrollment is a statute that was used by the Florida legislature that's separate from any athletic rule that they've made. So they didn't intend this to affect athletics, I don't believe. I believe the intent was to just give every school an option to say that, look, we've got enough students, we can't take anymore. So the new controlled open enrollment policy makes it to where if your school is what's called at capacity, you can't take on any more students. So FHSAA has said, if you can't take on any more students for your enrollment, we're closing the door for you for athletics as well. So if a homeschool student hypothetically lived in Okaloosa County or Walton County and wanted to attend one of our schools because they're homeschooled, they would be able to through FHSA rules. Because they're a homeschool student, they can go anywhere that there's a seat available. But if your school's at capacity and it's closed, then that option is not made available for that school. So controlled open enrollment has had an effect on athletics, and it's had an effect on students' eligibility. So if a student contacts you, what you should say is go to guidance. You don't talk to them about coming to your school. But if someone did contact you and you were in a conversation with somebody about maybe attending your school because they go to a private school or a charter school that doesn't offer sports, or they're a homeschool student and they want to play football at your school, you should know whether your school is at capacity or not. You're either open or not. If you're closed, that student cannot go to your school unless they move into your zone. So that's just the way the rules are. I know we have several schools that are closed at capacity now. I would hate to guess because I'd hate to say somebody's going to be wrong, but usually Niceville is at capacity, and I think Fort Walton Beach may be at capacity, but I'm not sure about that. So if you're at capacity, for any non-traditional students or collegiate student that you would have normally gotten in the past, that student's no longer available to attend your school because you're closed. Now, if a student was to move into your zone while you're closed, that student can play sports for you. Even if they're homeschooled, they'd have to live in your zone. Okay?
Even if you're at capacity.
If you're at capacity. So every school that's at capacity, Mr. Horton would have been the best to speak on this, but I've heard him speak, is every school is built in a buffer of about 20% for your total enrollment seats available. That buffer is for kids that move in your zone. So any student that moves in your zone that's a non-traditional or a traditional student, they're eligible to play sports for you. They can choose not to. A homeschool student can move in your zone and choose another school that they can get a seat at. But if the school's closed, they can't go there. So that's just the way controlled open enrollment works. I know a lot of people have questions about, they'll call and say, well, I know somebody who's real good at this sport and their family's asking if they can come to our school. And my first question is your school closed or open? So as a coach, you need to know that so you're not giving people false information, because once you're closed, the student cannot, they would have to move into your zone. Okay? Any questions on it? You don't have any more, because I think I told you all that I know. If there's any more details about controlled open enrollment, there is a process, but Mr. Horton's office oversees that. And I know that we've had schools that have been closed at capacity, and then the next year their numbers dropped, and then they were open for a little while, and then a couple of months later they were closed. During that span where there was some months that they were open, students were allowed to go there. Once a student's in with you, whether they're homeschooled or not, they're grandfathered in. So if you're ever closed later, we wouldn't boot those students out. That would be yours.
Does that change each school year though?
Yeah, so I don't know the answer to that. I ask your principal how they're doing the controlled open enrollment, because I don't know if they revisit those numbers every year. But your school,
They do by request.
They do it by request, so it could be a
It could
request.
change from last year to this year. Next year.
So if I had a student, if I had a player this year who was homeschooled and able to play, and they're going to be homeschooled next year, we have to reevaluate it next year. Is that correct? Okay. So they won't be grandfathered in for next year.
Is Choctaw's open or closed?
Well, yeah, but I just
If
wanted
your
to-
school's open, you don't have to worry about that issue. It's only for schools that are reaching capacity that we're having to turn away potential athletes.
Right, but if we become closed by that time,
Yes, then it would become an issue.
that's what I'm saying. Would you be grandfathered in?
Yes, if he's already participating there, he would be grandfathered, he can stay. Yeah. Any more questions on that controlled open enrollment? All right. And then the other part of Mr. Horton's topic on the agenda was the newspaper and public relations, and I'll echo what he would say, and then I'm not going to answer questions on this because I'm not as involved in that, but if you're putting something on your school website, as long as it's monitored by your school website or school personnel, then we're going to trust them as a source. But if you've got a parent that is, and he mentioned this yesterday to a group, and so I'm just echoing it, but if you've got a parent who's representing your sports programs and they're monitoring a social media site, then I would warrant probably against that or have somebody look into it, because whatever someone puts up, if they're putting your program on the face of it, you're really responsible for that. And we've had situations where some of the stuff that's on their feed for social media, and I'm not even sure what social media thing it was, to be honest with you, but it was probably not appropriate, but it was kind of the face of a program. So just recognize that you're responsible for the program you're the head coach of. And if it's represented on social media in a negative light, they're coming and pointing the finger at you, not that parent that inadvertently put something on there that's maybe inappropriate. So just be aware of anything that your community or parent group might put on social media. Just make sure it's not tied to you unless you're in charge of it. If you are tied to it, then you need to become in charge of it. As far as regular media, we've not had any issues over the last year or two, but social media has become an issue. So just have a discussion at your school with coaches, kind of get some feedback from them and find out what's going on. I'm not the social media guru, but I do know that every once in a while something will pop up because this is on social media and everybody sees it. And it's kind of like when you send an email out, it can be read in many different ways. Like the intent of the email was not to be negative, but somebody read it that way. Well, that's the same thing with social media. Just because it's out there, you may not have thought it was bad, but another 100 people saw it and were offended. So just be conscious of where social media is going and how it represents your program. Okay, and I know that the people from Andrews Institute are here.
Absolutely.
So, for those that don't know, this is Kathleen McGraw, and she is the
Outreach manager.
outreach manager for all of the athletic training services. So I'll turn it over to you.
Perfect. Thank you, Brian. I appreciate the opportunity to be here with you all today and this afternoon. I know it's getting to that post-lunch, like early afternoon time where everyone's excited and anxious and wants to go do sports or just be outside, not here maybe. But appreciate the time. We're going to try to make this valuable information for you. Some of this is things that hopefully is not new information to you in the sense that we just want to refresh and remind. But I want to kind of give you a comprehensive overview kind of what we've got. Appreciate, again, the time to be here with you guys. So we do have a few more folks, our other athletic trainers that are kind of coming in. We want to try to keep it going for you, so we're starting a little early. But our partnership here with you guys, we're really proud to be your official sports medicine provider for Oak Ridge County Schools. That does include, obviously, you as the high schools, but then also the middle schools, working with them, being accessible to them. We'll talk a little bit about that, but not belabor that point. And being there for them as well. So our outreach program, if you are not familiar, if you're a newer coach, not familiar, I know some of you are very familiar with our program, but we do have 23, we're providing sports medicine coverage to 23 public high schools in the 4-county area, and that is at no cost to the schools or the school districts. So, like I said, we have the additional coverage to the middle school football games for you guys, other community events, and you've seen this around, local colleges and performing arts settings. We are just really kind of all over the place. So, moving and shaking everywhere. I always tell everyone, nobody wakes up and says, hey, we played enough games this year. I think we'll play less. So it's just more and more and more, but we're proud and happy to be involved with that and keeping everybody safe as much as we can. So we do have full-time, and fortunately, some PRN certified athlete trainers that work with us. We do host the free event annually for pre-participation physical exams. I know y'all currently are not participating in that too much, but I just want you to know it is something that if you have someone who's missing whatever other services y'all have lined up for those, I know I think we're getting Crestview involved some this year, but they're open and welcome to come. And just as we start to get where if your school wants to really be bring the bulk of your student athletes, we just want to know about that and be able to plan for that so that it runs smoothly. That's our goal there. And then we also have concussion baseline testing, of course, we'll mention some more, and then Saturday morning injury clinics in the fall. That is a free clinic visit that's open to any of the student athletes, and it's really actually ages 5 and up. So if you are connected to the middle school, anyone else in the community, as long as they're a student athlete, we will happily see them. The clinic visit itself is free. If they need x-rays, we do have that service available on site that day. That is something that does get to the billing portion, and any, of course, follow-up after that. But any care or advice, evaluation they receive that day is free. So, real quick, before I introduce Dr. Brothers here, just want to give you the highlights of our staff here. This is our leadership for our sports medicine outreach department. We're really fortunate that we have grown a lot over the last few years and excited to continue to expand our services and what we're able to offer to everyone. As Brian mentioned, I'm the outreach manager. If you ever have any questions, concerns, feedback, hopefully good, not just all bad, but good or bad, please don't hesitate to reach out to me. My cell phone number is up there. I know it's hard to see, but I will tell it to you right now if you have a pen, 706-296-0642, or get it from a friend or your athletic trainer. Please feel free to reach out to me if you have any questions. But also, Matt, who you'll hear from today, is our regional athletic training liaison. You'll see him around, and really the main reason I wanted to show you this team here is because we are trying to round and get out to your schools and see what the athletic trainers do and don't need, if there's anything we can do to help support them. So you may see these folks as well. We try to attend a lot of the games as well. So Bill Henry is our events coordinator. If there is something additional extra going on that you would like our services for, he helps negotiate and work that out. Tim Dunsford, wave Tim. Tim is our newest team member here with us. He's not an athletic trainer, but has a lot he brings to the table, a lot of background in the club sports arena. And so we're very excited to have him as well, and he helps with that as well. Julie Kellen and Dr. Milligan there. Milligan's our medical director and our director of external growth and development. So just wanted to let you know you have these resources here. I will show you here, I hope you know at least one of these folks, if not more of them. They are here or arriving. You'll see them and hear more from them in a little bit. But Amanda, who is primarily at Crestview, Jessica at Baker, they should do a great job working with Laurel Hill as well. Nick Gutierrez at Choctaw, Kimberly Coffee at Fort Walton Beach, and MC Wright at Niceville. So we'll get to them in a little bit. But as a real quick reminder, we do have Andrews Institute locations around the region. We've been in Escambia and Santa Rosa. Brian stole a little bit of my thunder, but that's okay. We are excited that we are coming here to Okaloosa County, and that's with our Fort Walton Beach location coming, and that is with Dr. Brothers, who are excited to have here with us today. And so I'm going to just turn it over to him, let him say a few words about his background, and excited to be here.
Good afternoon. So thanks for having me. It's been real exciting to finally be able to bring Andrews Institute to this area. I've been here since 2003, so I've known the Andrews folks since about 2004 when they started. The area has such a great history of sports and high school athletics and middle school athletics that it's great to provide the top level of care for the athletes. I will have an office that'll be on Racetrack right across from Choctaw High School, and we hopefully will be there by the end of June. The whole process of getting an office built promised in March, and so now we're out to June. But I'm going to try, at least at the beginning, to block off Monday mornings for the athletes. So you guys will have someone, you can get the athletes to us and get them evaluated and treated or further worked up as quickly as we can. I know there's been a lot of desire for a Saturday clinic, which they do have in Gulf Breeze. So I will be working with the community and with a lot of businesses to try to get support so we can try to stand up a Saturday clinic in our area as well. So we will be working on that. I know how important it is for the coaches to know the status of their athletes, get them back on the field, or at least know whether they can or cannot get back on the field. So I've done that a lot while I was in the Air Force with the military kids, and I'll try to do that for everybody now. Like I said, I was here in 2003 through the Air Force. I was here for 11 years at Eglin Air Force Base, a couple of deployments to Afghanistan, so I'm very comfortable with all traumas and sports medicine. So I'm happy to be here and represent Andrews. Do you guys have any questions for me? No? Okay. Well, thank you very much, and I look forward to seeing all your athletes.
Awesome. And in just a few seconds here, we're going to pass out some little packets to you, and we will include a flyer for Dr. Brothers so you can get a little more information. Feel free to take that back and share it, copy it if you would like it digitally, we can send you that as well. But he is currently seeing patients and continue to do that as well. So our team's going to pass out these as we continue on. Keep it moving. And we'll talk through the other things they're handing you here in a little bit as well. As many of you know, in Okaloosa County, we currently have 5 full-time athletic trainers that are providing services at all 6 high schools. Our athletic trainers are available to, of course, you, but also the parents, families, administrators, your faculty, staff, anyone that we can help, we want to. And as Dr. Brothers mentioned, certainly in Andrews Institute, we understand the need to facilitate a student-athlete appointment and getting them to the appropriate medical providers as soon as possible. We know that these injuries don't just affect, particularly in a team sport, they're not just affecting the one individual, but that does impact the team and the season as a whole. So access and availability is something that we really take a lot of pride in and want to make sure that we're meeting our expectations there. If there's anything we can do better, you've got thoughts, concerns, anything like that, please let us know on that, okay? Obviously, sometimes we got to work around insurance, and we know that is really the bane of most everyone's existence when it comes to healthcare, but we're working on that. So our goal as your partner is to help create the environment for an expectation of optimal performance and health promotion. Essentially, that's what it boils down to. We want to maximize the performance while protecting the student athlete. And these are the principles that are practiced collegiately, elite level, professional level, because that's just really what's well proven to contribute to the performance improvement. So our student athletes, we want them to be able to reap those same benefits, and we want to be your healthcare partner in that. So without further ado, I'll figure out where they're all scattered to, but I'm going to go ahead and turn this over to Nick. There he is, coming back up here. You're going to hear a little bit from each one of our athletic trainers, hopefully to keep it exciting, so you don't have to hear me talk for an hour. But ready?
Yeah, I'm ready.
All right,
Sorry
here we
about
go.
that. Thank you. Hold your applause. That's all right. My name is Nick Gutierrez. I'm the athletic trainer over at Choctaw High School. I'm just going to talk real briefly on what an athletic trainer is and does, and just a little bit of our coverage expectations for you guys and us. I'm pretty sure we have a good idea of what an athletic trainer is in here. If you don't or don't know who we are by now, then maybe got to get on that and start seeing them a little bit. But to give it a definition, athletic trainer is a certified and licensed healthcare professional who practices in the field of sports medicine. Okay, so we work real closely under the supervision of our physicians at the Andrews Institute to pretty much cover these 5 domains up here: preventative services, so things like taping, stretching, bracing, emergency care, clinical evaluation, so evaluating injuries, therapeutic intervention, and rehab of injuries and medical conditions. So I know this is a high school right here, but some of our schools have a little bit of middle school involvement as well. So I'm going to talk about the scope of that. So us as athletic trainers, we are in the high school setting. All right, so we're not necessarily at the middle schools every day, or really not too often. But there is always an athletic trainer for the middle school games. Matt McGraw here and some of our other PRN athletic trainers help out a lot at those football events for middle school. But we don't want you guys to think that we're kind of just leaving them out on the island, all right, that our service to them isn't accessible, okay? So for you guys, if you have kind of, any children in middle school, family members, friends and whatnot, try to give them a heads up if they need something, related to sports medicine or injuries, let them know, hey, we got our athletic trainer here, give them our information, and we can talk to them and kind of help them, move along, depending on what the case may be. So that's the biggest thing, is we don't want them to think that we're not here for them as well, even though we're mainly in the high school setting. So they are included in our summer baseline concussion testing, which is going to be coming up here in June. The test is good for 2 years. So middle school, when they get in there, 6th grade, they'll take the test and then retake it again 8th grade year. And then we'll have them redo it again once they get into high school in 9th grade year. So we kind of try to get on a freshman junior track. It makes it a lot easier on all of us to keep up with all of that. So for high school, now this is where you guys probably have a better idea of what we're doing. Most of us generally, we get there around 12 to 1 o'clock, about an hour before the first practice starts or before school gets out. We're there until practices are over, until home events are over, okay? So we cover all home events related with the high school, all FHSA sports. Now the only time that we might have some conflicts during the fall season, especially with football, is maybe with volleyball. Now we're always going to be at every home and away football game. That's where we're going to be. That's our priority, and practices as well. So it's just a big thing about communication. If we do have, say, a freshman or JV football game, there's a home volleyball game. It's just going to be you as coaches and the athletic trainer communicating to figure out how we can maybe get that covered, or just maybe getting you some supplies or something like that, so you can take care of anything basic, maybe some first aid stuff or taping up a wrist or something like that. So with that, again, later in the year when there's a lot other sports going on, sometimes baseball, softball going on, basketball, soccer going on. Again, it's just going to be communication with you guys and your athletic trainer just to make sure that everything is taken care of, and that we can kind of get from venue to venue to make sure we're getting everything covered and the kids taken care of. Okay. So same thing with our concussion baseline testing. Again, it's coming up in June. A lot of this information should have been pushed out to you guys already, whether from us or from your athletic director, so check your emails. If you haven't received anything, just get with your athletic trainer and we can get you the information, your time slots for your teams, and what day you're going to be having the concussion baseline testing. So any questions on that, just refer right to us and we'll get you moving in the right direction there. Okay. So for additional events, like I said, we'll be covering all home high school events. Postseason, some coaches and teams like to bring their athletic trainer, down south, Final Four and stuff like that, or away games for the postseason. That's totally okay. Just try to get on the ball on that and let them know if that's something you're wanting to do, so that we can figure out if there's any conflicts or any coverage we need to get taken care of. We would love to do that, deep in the postseason. It's nice to have your athletic trainer there to help you if you guys need anything during that time. So the one thing is now, so if you're going to be loaning your field out or your gymnasium or any facility out for anything that's not necessarily related, FHSAA, so AU tournaments, or like a big one is our Kentucky Baseball Week, then we're not exactly expected to be there and cover that. But we can work that out. If you get with Bill Henry, he's our event coordinator, which Kathleen mentioned earlier, we can work out our services for a small fee. So we just don't want you to think that if there's a tournament going on 8 in the morning, we're not expected to be there 8 in the morning and there throughout the day. So just be aware of that. And it's not that we can't help if we are there at the school. Again, it just comes down to communication. We can still kind of go over there and take a look at a kid if they got hurt the previous day. Give them a check out in our room or whatnot. But it's not expected that we're going to be there at that event all day long, or whatever the case may be. So that's kind of about pretty much it for our coverage. and one athletic trainer is. So at this time, I'll pass it over to MC Ray, and she's going to talk a little bit about the healthcare team and a little more on communication. Thank you.
Hey, everybody. How are we doing today? Good? Okay, good. I'm not the greatest speaker in the world, so y'all bear with me. But we're going to go over a couple of things about communication with athletic trainers, coaches, and ADs. I'm going to say communication probably about 50 times, so if y'all don't understand that word, go look up the definition and get to know it, okay? But basically, just to define what an athletic healthcare team is, it's a group of professionals, of all of us, okay, that work together to prevent injuries and promote a safe playing environment and provide medical coverage for athletes, spectators, and officials. So we like to use clinical standards of practice, but basically in a nutshell, we're all just trying to work together to create a safe environment for the kids, okay? So exciting news is you guys are also a team member in that healthcare team. Okay, so athletic trainers and physicians are the core members of the team, and then we have ADs and coaches that play the extended members or additional members of that healthcare team. So some ways that you guys can help with the healthcare team is communicating practice and game events with the athletic trainers. It is very, very important for you guys to let us know when our events are going on, when we have any additional games or anything that's going on, particularly like on the weekends or when you're going into postseason. All of that's really important, and it's much better for us to find out well than 24 hours in advance so that we know what's going on at all times so we can keep your kids safe. Pre-participation, examination, coordination. What we mean by that is just whenever you get your physicals done, I know a lot of the schools, you'll have an assistant that helps with that, making sure that you communicate with the athletic trainer, hey, I've got everybody's physicals done, or I've made some extra copies for you to keep on hand. So that way we can keep that straight. Parent and booster club support. So we all know that parents like to be heavily involved within the environment of our athletes in the sports realm. So, a lot of times you can advocate for them to have, boost for supplies such as like prophylactic bracing or preventative bracing for injuries. They can give money for certain rehabilitation stuff. And also you can also get them involved with coming to parent meeting, like having us come to parent meetings. So if you know the dates that those are coming up, go ahead and send a text and communicate with your athletic trainer and let them know so that they can try to be there. We can't make it all the time to everything, but the more meetings that we can make it to, the more we can get out there for the parents and talking with them. And then accessibility of emergency entrances. What I mean by this is everybody here knows that we all have a standardized emergency action plan at this point. It's still been rolling out and everything where we're getting everything, emergency action plans on each field and stuff. We've been doing that for the last year or so. I went to a meeting at FIAAA convention at the beginning of the month, and I asked all the ADs there if they had an EAP. And of course, they all stood up and said yes. And then I asked them if they had reviewed it with their coaches since January, and they all sat down. So, and that kind of was an eye-opener for me because, we need to know what's in our emergency action plans. We need to know, what our address of our school is or who the coaches are to contact in the event of an emergency. So, communicate with the athletic trainer, communicate with your AD, get to know that EAP and understand that so you're ready for your seasons. And then kind of tying it all together, keeping each other accountable. So again, discussion of the EAP, supporting us as athletic trainers and our physicians that cover the schools, and then inviting healthcare team members to those parent meetings. That's really, really important. I think my volleyball coach is actually having one today, so we're going today. Okay, so from day to day, you guys, the coaches and ADs, y'all are obviously in charge of safe direction, instruction, and training of the sports and team individuals. If you're communicating that and advocating for those safety policies, then we're always going to be safe and have a perfect time, right? And then obviously adhering to those policies and protocols. So in our EAP, there's protocols for heat, lightning, there's ice tubs, the works. Okay, we have that all set up for you. So if you're communicating with your athletic trainer, you're understanding that emergency action, and you're keeping a safe realm, then we're able to prevent more injuries and even potential fatal situations.
For ADs and coaches, if y'all know your athletes really well, if you start to learn and understand them, try to relate with them, they will. The outcome of the efficiency of care in the event of an injury is much more beneficial. So if you're not quite there with your athletes, try to push a little bit harder with them and communicate with them as well. See what kind of background they have. And then in meeting and greeting with a physician and an athletic trainer, we always try to reach out with you guys in preseason just to say, hey, this is what we have coming up. This is the kind of schedule we're going to run into. We may have to hop back and forth or this, that, and the other. So make sure to reach out if we haven't already reached out to y'all, because sometimes we got a lot on our plate. So it's helpful to have y'all's help too. So with injuries and medical needs, as an athletic trainer, we're trying to treat and assess the injury, right? So in that case, we need those extra hands to help us. And this is where y'all really come in and help during a game or event. Since y'all have those relationships with your athletes, calming the athlete during the time of freak out mode is really, really beneficial for us, because we can continue to do what we need to do on our end while y'all are keeping the athlete calm. It creates an efficient flow for the safety of that athlete. And obviously y'all can help with assistive carry too if we're getting them off the field, or if we have to call EMS. There's always a chance that you have to get out the spine board and know how to do that as well, so y'all can assist with that too. If the ADs or coaches, if y'all have additional assistant coaches, you can kind of appoint them jobs to do too in the event of an emergent situation. Who do you have assigned that can go get an AED? Who do you have assigned that can go get something from my kit or one of their kits? Who can call 911 and direct EMS? If you haven't already thought about that, start thinking about who your assistant coaches you can appoint those jobs to, because that's 4 little jobs right there that can already be done, whether it be between 2 people, 1 person, or the 4 or 6 people that you have. And then always encourage and reinforce the utilization of us as athletic trainers. Yes, we work at high schools full time, and we help a lot with the middle schools. I get calls all the time. But we also are here for the community. If you have anybody that you know of that needs assistance with something, particularly in the orthopedic realm, feel free to give us a call. We're always available to help you guys. So everybody at the end of the day plays a vital role in the health care of student athletes. Sometimes, you know, the little tedious jobs of, oh, I just have to go get this tape, or, oh, I need to go grab the AED. Yes, it seems like a small job, and it might not be vitally important in that moment in time, but it could be a life or death situation. You never know when that's going to be. So the more that you practice, and the more that people understand what their roles are, and it's not so much of a blur or a gray area as to what people are doing, the better the efficiency of care is for that athlete at the end of the day. We're one athletic trainer in the middle of a ton of athletes, a ton of coaches, and a ton of parents. So that multi-directional communication is key. You know, we are trying to, all of us athletic trainers here and in our other counties, we're trying to do the best that we can to keep communication round circle. But if y'all also put in the effort as we do, it always, again, it helps with the efficiency and flow of the care of that patient. Anytime there's a medical injury, need, or issue, feel free to reach out to us. Again, communicate, communicate, communicate. Yes, we're at the high schools full-time. We do help out the middle schools part-time. So anytime that there's an injury, I know Coach Denton, I'm going to call you out. You've called me a couple of times with a middle school athlete, and it's been very helpful, and the parents love it. And not only do they love it, but it creates a relationship between myself and the athlete, or them and the athlete, prior to them coming to our high school. So feel free to reach out to us about that. And regardless of the severity of the injury, it does not matter how big or small, anytime that we can look at it and we know what's going on is going to benefit the safety of the school in the long haul. And it's going to benefit us, it's going to benefit y'all. It takes the liability off of y'all all day. So please get used to communicating. Okay? Particularly if an athletic trainer is not present. So as y'all well know, in the spring, there's like 8 different sports going on. So a lot of us will kind of share 20 minutes at a time, going from place to place to place. If anything happens, big or small, give us a call or shoot us a text, anything that you need to do so that we know what's going on. Optimal communication really leads to successful healthcare management. Something that, just to touch on a little bit, if my AD, for example, were to appoint jobs to his coaches for the football team, let's say we had a kid go down on the field, it was a knee injury, and I'm having to run out there, there's people running on the field, there's all kinds of crowds trying to figure out what's going on. If somebody is already there and able to help with crowd control, help with calming the athlete and getting me to the patient, I have a 90-second window with a knee injury to figure out what ligamentous issue is going on with that knee, if we have one. If there's no crowd control, there's no communication, and it's all a big mess, that 90-second window is wasted, and now I have a patient that's guarding with a knee injury, and I can't figure out what's going on. So think about that. If y'all can, I know y'all aren't athletic trainers, I get that. But if you think from my perspective or their perspective, we have a real big time crunch with what we have to do for that patient at that point in time. So if you have those appointed situations already figured out and everybody does their part, at the end of the day, we can really keep an efficient flow in the quality of care for our athletes. I'm going to hand it on over to Matt.
I might hit that a couple of times, so I move my hands a lot. I'm actually not used to standing behind podiums, so just bear with me. All right, so I'm going to talk a little bit about emergency preparedness and what does it mean to you. So let me ask you a quick question. What does emergency preparedness mean to you? We live in Florida, right? So one of the biggest things that we are prepared for in emergencies are hurricanes. How many of you grew up and lived your whole life in Florida? Well, a decent number. How many people are fairly new to Florida the last year or two? So everybody's been here a few years. So every year you probably prepare for a hurricane, right? Yes, no, yes, most of you, right? Well, I've been here for about 8 years now, and I tell you, once I found this checklist, about half of that I had never even really thought about. So I say all this to say emergency preparedness, it can apply to a lot of different things. And sometimes just because we are involved with something to a certain level, it doesn't necessarily mean we can think about every little thing that we might need or situation that may arise. So I'm going to share with you a couple of scenarios right quick about a couple of athletes and their outcomes. Okay. So the first one, it's a 17-year-old cross-country runner. This cross-country runner collapsed during a training run. He was diagnosed with a heat stroke. He was put into a medically induced coma in the hospital because his core body temperature was elevated to the point of over 106 degrees. Anytime that we get over 104.9, there is a very big risk of internal organ damage, especially if that temperature stays up there more than 30 minutes. So they put him into the coma to kind of slow everything down so they could lower his core body temperature. The athlete did make a full recovery, and he ended up returning to his sport. However, a year later, he brought a lawsuit against the school, saying that the coaches were not prepared. So one of the reasons that we wanted to talk about this today is to make sure that you are prepared. The second scenario I have, it's a 16-year-old basketball player. After the game, a student athlete collapsed. 2 coaches were there and they performed CPR and went and got the AED and put it on him. He was taken to the hospital and made a full recovery. 2 different scenarios, very similar outcomes. Both athletes survived, but one ended in a lawsuit, the other did not. So just some things to think about when preparing for potential emergencies, okay? So when preparing for emergencies, what do you think? Just real quick, shout out what you think it is. What are the 4 leading causes of death in high school athletics? Heat, sudden cardiac arrest, okay. What else? Dehydration kind of falls under heat. What else? Heart, okay, heart. That's 2. Head injuries, that's 3. All right, this one's always tricky. So the last one is hemoglobin. It's actually sickle cell a condition, okay? And we'll talk about that a little bit later on, but those are the 4 leading causes of death. So I guess run for it's not really an adequate form of, hey, we're prepared, right? So just to talk a little bit about what an EAP really is. Well, it's a blueprint to handle all of your emergencies, whether it's an athletic emergency, whether it's a weather emergency. If you have a tornado, you have a plan for that, right? If you have fire, you have a plan for that. Well, the same thing with athletic emergencies, okay? So, and it also applies to off-season workouts. A lot of people forget about the off-season workouts, especially the summer when the athletic trainers are not there. We're doing a lot of the baseline testing. We are usually available via phone, but we're not always on site, right? Now, the EAP must be easily understood. Now, we've already taken the EAPs and made these all for you already, right? The biggest part is that we ask from you is to make sure that you read through it, that you understand it, and that you feel like it is the best plan possible, okay? And we'll talk a little bit more about that here in a second, okay? Now, the EAP does need to be specific to the practice sites, game sites, or competition sites, okay? So if you have 3 fields that you practice/play on, all 3 of those need to be in your EAP, okay? It is important because we'll talk a little bit more later, but because of entrances or access, okay? In the EAP, it does describe the authority, the roles, and the responsibilities of everyone involved, and everyone is involved, okay? If you have 1 coach or if you have 8 coaches, everyone has a part to play, okay? And if you only have 1 coach, the athletes might actually have to play a part, okay? So these are things you got to think about. So why do I need emergency action plans? Well, ethically and realistically, it helps to ensure the athletes receive the optimal care as safely, efficiently, and smoothly as possible. Professionally, the NCAA, the FHSAA, and the FHSAA have suggested that all member institutions develop an emergency plan for the athletic programs. But most all, legally, the emergency plan has been categorized as a written document that defines the standards of care required during an emergency situation. There are multiple cases out against schools and or coaches regarding not having EAPs or being prepared. So this is probably one of the most important ones to protect you, okay? Well, the FHSAA does have a policy regarding it. In it, it says basically all member high schools develop one. Have it. You need to coordinate, review it, and rehearse it annually with all your on-site key personnel. It needs to be written, it needs to be shared, and it needs to be posted. And we talked about already having it posted at each venue. So if you happen to notice you're at your venue and you don't see the EAP or know where it's located, make sure you talk to your athletic trainer and say, hey, where is this? I know we reviewed this, but I want to make sure I have a copy just in case I'm not here. Okay. On there should be a location of all emergency equipment that may be needed, such as an AED. It should have any contact emergency personnel, the facility address, the specific facility address, and location, as well as contact information that's needed. All right, this goes a little more depth. It talks about a little bit more of the pieces of the EAP. Make sure you're familiar with it. If you don't have a copy of it, get with your athletic trainer, get a copy. If you want it digitally, we'll get you a digital copy. But make sure you have it, you've read it, and you reviewed it, okay? At least annually, but preferred multiple times a year. And on here, here's some examples of venue maps. So some things to think about when looking at the maps. Look at where the access is for emergency personnel. Is that the best? Is that the correct? We'll talk a little bit more about that here in a second, but is it the most accurate and up-to-date one? Okay. On here, you can see the bottom of the one on the right. You see a little heart shape thing. It's actually a symbol for an AED. That's the location of the AED. So that's another reason of having a map, so you can actually look at it and go, okay, I know exactly where that extra AED is located, in case the athletic trainer is not here. Okay. All right. So here's an example of Gulf Breeze High School. I don't know if many of you have ever been to or seen Gulf Breeze High School, but I throw this up here because it's a little different. It's got a major road running through the middle of it. They've got fields on both sides of the road. They've got AEDs on both sides of the road, mainly because of that. But you look at the numbers. The numbers are gates, locations of gates. Gates are important. Are they locked? Who has a key? Can we get through that if we have an emergency? If for some reason we can't get through that, what's our backup? Okay, so some things to think about. The little stars are rooms that the athletic trainer can use to evaluate athletes. And then on there, they're really, really small. It does have the AED locations. And in case you're wondering, there are 3. One's in the school, one's in the gym, and one's in the field house by the football field. The AED should be accessed within 3 minutes or less. So the gold standard is actually 1 to 2 minutes in order to best save someone from getting it to putting it on them and getting it going. But again, making sure that there are no gates or locked doors that are in the way. All right, so we talked about the AP. We got one, we're good, right? Well, the AP is actually a living document. Like we talked about a little bit earlier. You want to review it annually. Okay? Annually sometimes isn't always enough. You do off-season stuff, so probably before you start your off-season stuff would be a good time to check back over it, make sure nothing has changed. Okay? So in preseason, when you're planning this, these are some of the people that need to be involved with your EAP, and even talking to them about, hey, if we do need emergency access, who is it? Where are they coming from? Who can help? Okay, so definitely your athletic trainer. Your school resource officer is definitely a resource as well. EMS, we're working really hard with Okaloosa County EMS to build our relationship with them so that they are familiar with us, with our protocols, and we're familiar with their protocols. But also, we're hoping to get to the point where they're coming out to the schools on a more regular basis so that they can get to know you, the coaches, so that you're familiar with them. Because one of the biggest things that can scare an athlete is not being familiar with people that are trying to help them or trying to save their life. So we're trying to build those relationships with our different partners so that everybody becomes more comfortable with when or if they have to potentially go into action during an emergency. Okay. Making sure that your AP has been given to all responders. And that's something that we're actually doing with EMS. We're making sure they have a copy of the most recent EAP so that they can get the information straight from dispatch. And I believe they're actually working on some kind of digital format where they can actually push out the maps and locations and phone numbers and everything that they need as well. So that's something that we're still working with them on. Know your role. If there's one coach or 8 coaches, like I said earlier, know what your role is in that scenario. All right. Again, access to venues, locked gates, doors. Are there any? Is there any construction going on? I don't know which entrance you came in when you came in to Northwest Florida State College here. But I came in through, I think it's the West Gate. I had to figure a way around. Yesterday was actually a little bit harder. Today was a little easier. But yesterday was a little harder because they actually had that whole road blocked off. So I had to go back and figure out how to get back over here. So those are the types of things that we don't want EMS to have to run into. We don't want them to run into, oh, there's a block or there's a construction going on. We want them to know exactly where they have to go so that they can get the care to whoever they're giving care to as quickly as possible. Okay. Parked vehicles. I know one of our athletic trainers recently, I think it was during a game, had an issue with someone showed up late to a game, parked right in front of the gate that the EMS was supposed to be coming through. And they had a time figuring out who that person was to go move that car. So making sure that those things are also thought about. Okay. Emergency equipment accessibility, AED. So if you have 2 AEDs on campus and they're both behind locked doors, are they accessible to you if you need them? Something to think about. You know, we ran into this issue recently with one of our schools where the AED was located in the field house, and only the football coaches had keys. What about baseball, softball, soccer? What about all those other sports that would have to use that same AED? The only other AED besides the one with the athletic trainer was in the school, and no one had a key to that. Well, through talking through it with them, they figured out everybody's got a key to the weight room. So they relocated the AED to the weight room. So think about those types of things when when looking at accessibility for emergency equipment, not just AED, but anything else. Okay? Again, you want to rehearse, review, and revise the EAP as needed annually. Okay? Some really good quotes that I've come across over the years is, it's a living document. Hope for the best, expect the worst. If you hope for the best but expect the worst, you're going to be prepared for almost anything that comes upon you. Okay? Practice doesn't make perfect, only perfect practice makes perfect. You know, each one of you are coaches, right? So you practice plays, all practice long. Well, that's all we're trying to do right here. We're just trying to practice something that we might have to enact, hoping that we don't have to enact it, but we practice it with that same kind of thought and intensity that we might have to actually do this one time. Okay? Making sure that EAP is distributed between all your people again and displayed at the venues. Here's some examples of some of the ones that we've done. If some of these look familiar to you, they might be your schools. If not, that's okay. But if you have suggestions on where to locate your EAP, maybe you don't know where yours is, or maybe it's not in the most ideal location, communicate with your athletic trainer and say, hey, maybe let's look at this over here, or let's talk about relocating that. So conversation is good. Like MC said earlier, communicate. You know, the best thing that we can do is communicate with each other to provide the best care that all of us can for the athletes, right? Provide the safest arena for them to participate in. One of the things that we do before every single football game is we kind of have a little huddle. We do a medical timeout with any other medical personnel that might be on site. Now, this is something that we encourage any of the administrators, any of the coaches that want to be a participant, we encourage you to let us know, because you're as much of a part of this as we are. But in this, we talk about teamwork. We talk about what's going to happen if something happens. How are we going to act? How are we going to react? We talk about the different protocols. We determine who does what job. If we have to carry an athlete off the field, who's helping? If it's a 300-pound athlete versus a 150-pound athlete, that number might change a little bit. But if you already know, hey, I'm one of the 8 people that might have to help carry this guy off, I'm ready to go. Okay? Confirm forms of communication. Are we doing verbal? Are we doing signals? Are we using walkie-talkies? How are we talking back and forth without actually talking necessarily? Communicate where the equipment is available. Is it in the locker room? Is it on the sidelines? Is it over there in the EMS truck? Where is all that located? Any potential issues that could impact the EAP or the response of the EAP, such as locked gates, right? Or crowds. Maybe someone is the crowd control. I think that was brought up a little bit earlier as well. Okay? This is where you hash all that out. Who's going with the transport with the student athlete? Is the parent there? Is the parent not there? Who's grabbing the paperwork for his PPE that needs to go with it and that has all that important information that could provide some use to the hospital? It's got pretty much all their healthcare information in there. If unsure, ask questions. So this conversation is less than 5 minutes. It's not something that takes a long time. Okay? In that, as you see in the picture here, we do have an official there. We've got EMS, we've got the athletic trainers, we've got a team physician, and then you can't quite see him, but on the far left, you see a little white shirt. That's actually the school administrator for one of the schools. So we do encourage anyone that can be involved in those conversations to be involved. And again, it's about 30 to 40 minutes before the game. Sometimes it may include EMS and sometimes it may not, depending on when they're able to get there. But nonetheless, we still have those conversations. Okay? And here's some examples of some people that could be included in the conversation, but also, like MC said earlier, who's part of the athletic healthcare team. All right, so in the medical timeout, we don't want to forget, or any competition really, we don't want to forget about all the other people or players. Okay, we all think about the athletes that are on the field, on the court. What about the cheerleaders? What about the spectators? What about the coaches? What about officials? What about halftime? I know a lot of you have large bands. We've had some band members that have passed out from heat. We've had other ones that actually had some sickling issues that had to be sent through EMS. So those are part of the conversations that need to happen. It's part of the EAP. And what about this? That's a problem, right? The band's in the middle of the field, stands are full, and there is a giant lightning strike. Right? So I don't know how long ago that was taken, but hopefully they fixed the problem. I don't want to steal Kim's thunder. She's going to talk a little bit more about that later. But after an emergency event, you got to review with your involved emergency personnel. How did that event turn out? How did we all react to that emergency event? What went well? What needs to be improved? How can we get better at this? It's exactly what you do after a game, right? You watch game film, you talk about what went well, what went bad. Let's fix the problem, right? So that's all we're asking. Usually doesn't take very long. But then if you come up with any improvements or any changes, that's when you change the plan. And we help with that. We can actually do all of that. We just need to know what needs to change. We review those changes, and then we make sure everyone that is involved or could be potentially involved gets that new EAP. So don't just hang it on the wall or put it in a drawer and forget about it. It's a living document that can save lives. Are you ready? Kim's going to come up and talk a little bit more about environmental concerns.
Hello, I'm Kim Coffey. I'm the athletic trainer at Fort Walton Beach High School, and I'm going to talk about environmental concerns. So the first thing is about venues. So I know a lot of coaches and refs, they just walk along their playing surfaces, and I know I do it sometimes too. But one thing to remember, like this is a basketball gym. I don't know if y'all can really see it, but just like support beams, make sure they have covering. I know tracks, we got a new one at Fort Walton, so we have to worry about this anymore. But just make sure that the things are covered, like there's sand right here, and like the sprinklers at the football fields, make sure they're pushed down because sometimes they come on and people can trip on them. And just flooding and things like that. And I know another concern is make sure that, I know different people use our different fields, so just make sure nothing is left on the field, make sure no nails or anything are left on it. So another big concern is lightning, and I know we hate that in the fall here in Florida, but we are the top state basically for lightning fatalities, and we don't want this to happen to any of our athletes. Our number is 47, and that's like next to Texas, which is pretty scary. So whenever it's lightning, please, 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 heed our warning. We're not trying to keep y'all from not practicing. We're not trying to stay out there any longer than you guys are, but we are definitely here for the safety of the athletes. So this is just a chart explaining where most of the deaths occur. 54% in open fields and ballparks and golf courses, 23 under trees, and 12 in the beach and things like that. So one big thing that us as athletic trainers we like to do, I know we have like the earth networks on top of our scoreboard or on top of our press box at the football field. It goes off. It has one long horn and it flashes the whole time. And most of us have the app on our phone where we can see, how long until that lightning strike has gone off, and then we can go back to practice. But if you don't, we have to wait 30 minutes. And then if another strike happens, clock starts over again. Even if it gets all the way down to 1 minute and that strike happens again, we got to wait 30 more minutes, unfortunately, to start practice or play again. And another app I like to use is WeatherBug, because I like to compare it because my coach likes multiple reasons on why I have to stop practice. So that's what I like to have. So one rule of thumb is when thunder roars, go indoors. And I know our earth networks, it's set up to 10 miles away. So when it's 10 miles away, we just need to go ahead and get inside. We don't need to wait. Just go ahead and get everyone inside, especially at any type of game. Go ahead and make the announcement so we can just try to get the athletes and the spectators inside as safely as possible. And just for safe shelters, we need to get them inside of a building. Doesn't need to be in the dugout. Doesn't need to be in the shed. Doesn't need to be on the corridor or the bathrooms. We need to get them inside of an actual building, or right here is the safe spots: field house, library, auditorium, the gym, or somewhere that's just enclosed. So we need to just be mindful. We don't want to be those people that have the news report saying, well, no one cleared the stadium and someone got struck. So we just definitely to take heed to those warnings. So this is just a chart showing 30 miles away. I know whenever it's bad weather, I do let my coach know, hey, bad weather's coming in off the Gulf today. Because I know a lot of y'all just like updates, like just a heads up. No one likes to be told when the lightning strike has happened and we have to just rush inside. So we just like to go ahead and let our coaches know. 30 miles, we just let them know. 15, hey, coach, it's getting kind of bad. Let's go ahead and be thinking about we're going to go inside. 10 miles, get them inside, no questions. And another thing we like to do, cross country is also going on during this time, so we like to let our cross country coaches know, anyone else that's practicing outside, hey, get inside, find somewhere to go to be safe, and we'll let you know when it's over. So 6 miles, everyone should be inside at this point. And we just don't have any activity until 30 minutes later. So Jessica is going to come up and talk about heat. Thanks.
I'm short, gotta move this down. I'm gonna talk to y'all for a few minutes about heat illness and acclimatization. It's important that we cover this because we do live in Florida, it gets hot, and heat is actually one of the top 3 reasons for death in athletics and high school athletes. So the FHSAA has a couple policies pertaining to heat. One of them is that you should have a policy established, so we've done that. We've created a policy for you. They also have an acclimatization policy. So for football, you're familiar with that. You go 2 days helmet, then shells, and then 6th day you can wear full pads. Cross country has one too, if you're not aware, that says that athletes must participate in a minimum of 10 separate conditioning sessions before they can participate in that first meet. So those are important. And it's important to note that if an athlete comes out on the 5th day of practice, if they don't skip ahead, it doesn't count as their 5th practice, or they're not automatically allowed to be full pads that day. They have to go through the same period that everybody else went through. So even though it's day 5 for everybody else, it's day 1 for them. So it's important to make sure that they get that time too. I know a big thing that we preach, our athletes don't always listen, is hydration. So I always tell the kids, game day's not the day to start hydrating. You need to be hydrating throughout the week. Good rule of thumb is 6 to 8 ounces for every 20 minutes of practice. And then if the kids weigh themselves after practice, a good rule of thumb is 20 ounces for every pound that they lost. And I tell them, mix it up. Maybe drink 1 Gatorade and a couple waters. Don't just drink 3 Gatorades, because that might make you sick to your stomach. But mix it up a little bit. And then most of these deaths do occur during football and cross country, so during our fall season. Heat illness is very preventable and very survivable if we know what we're looking for and know how to treat it. So these are the risk factors. So there's some environmental risk factors, such as high humidity, practicing with a high wet bulb glow temperature, which we'll talk about one day, and then come back the next day and having another high wet bulb glow temperature. The direct sun exposure, so try to get in the shade if you can at all. Individual risk factors. A big one to watch out for during the summer is sleep loss. You have these kids who stay up all night and then kind of practice in the morning and they haven't slept, haven't hydrated. If they've been sick recently, overweight. Another big thing to look when you're going over physicals is the medications that your kids are on. A lot of kids in this area, because of pollen, are on antihistamines, and a lot of kids take ADD medications, and both of those can put you at risk for heat illness. So it's important to know those kids that are at risk. And it's not always your kids, the overweight, or kids that you think are out of shape, that this is going to happen to. The kids that I've had to call 911 for and put in a cold tub unconscious was 2 of my best athletes on the team. And it was because of one of these environmental risk factors combined with some of these individual risk factors. We were doing 2-a-days. We came in, practiced for 3 hours in the afternoon, didn't go home until 6 or 7, came back at 7 o'clock the next morning for another 2 or 3 hour practice, and it's high humidity, and they didn't have time to recover, didn't sleep, didn't hydrate, and then have a heat emergency. So it's important to know these risk factors and know our athletes that are at risk so that we can prevent these before they happen. So there's different types of heat illnesses. Probably all familiar with muscle cramps. That's what we see the most. From there it progresses to heat syncope. So like fainting spells, getting dizzy. Heat exhaustion would be the next step up from that. And then finally heat stroke, which is considered a medical emergency. This means that your core body temperature has reached a very dangerous level and that it's time to activate our EAP. We rolled out our heat policy at an AD meeting last year. There's some really good charts in that policy. If you haven't seen them, one is this chart, and it just breaks down the different types of heat illnesses and shows you the signs and symptoms for each one, so you know how to differentiate between them. So that's a good chart to reference if you haven't seen that one. The big thing is being prepared if we do have one of these emergencies. So by now you've probably seen one of us with the wet bulb globe taking the temperature before practice and during practice. Y'all should have a tub or a whirlpool or some means of cooling an athlete at your school. We all have access to rectal thermistors and the tubs and the wet bulb globe thermometers. And then we also have tarps, so if a tub isn't available, another method you can use is, it's called a taco method with a tarp. So you have people hold the tarp up on the sides and put the athlete in the tarp, and I'll cool them that way. So for management, if we had this happen, we want to make sure the cold tub is available and accessible and that you have it set up before practice, because once this is happening, it's kind of too late. You need to get things moving. So what I do is I keep it in the shade during practice. Sometimes I'll go ahead and fill it a little bit with water as long as it's going to be in the shade so it's not getting too hot. Once our coaches finish getting the water ready, I'll take the coolers and fill them up with ice. You're going to need at least 2 10-gallon coolers full of ice to get this athlete cool, especially when it's hot and the ice is melting pretty quickly. So you don't want to wait to prep this. You want to go ahead and have it ready if you know it's going to be a day that it's hot. So the goal with this, you hear with concussions, when in doubt, sit out. The big thing with heat emergency is cool first and transport second. So with heat emergency, the goal is to get that body temperature down to 101.5 within 30 minutes. That's what's going to give them the best chance of a good outcome. The way we monitor that, it's the gold standard. We're all trained to use them, and we would be the ones doing it, but is to assess their temperature with a rectal thermometer, and that's that little picture that you see there. So you can see it's a long cord so that it stays in while they're in the tub. This is important because if we transport them before that temperature is down, then it may help them, but it's kind of we've done that all for nothing because we haven't gotten their temperature to that point that it needs to be to transport them. And the only way to accurately know that is with this rectal thermistor. And so just like you would use an AED if somebody was having a heart attack, just because they're female, you wouldn't bare their chest to put the AED on them. Same thing with this. It's the gold standard. It's what you need to use, and we're trained to use it, and we do that in the most modest way possible to protect the athlete and to make sure that they are provided with the best care. Then, and just to repeat, it is a medical emergency. You are going to activate the EAP if this happens. Matt's been real good about establishing connections with EMS in our county. So normally EMS, their policy is once they get there to transport right away. Well, we know that in this case, that's not what's best for our athletes. So we've worked with them, and they know that if one of our athletic trainers is on site and it's a heat emergency, that we're going to cool them first and then transport them. So they're going to work with us on that. That's good for you to know because in this type of situation, a coach is probably going to be the person making that 911 call because we're going to be taking care of the athlete. So if you do have to make one of these calls, let them know, hey, it's heat. We have an athletic trainer here with us. We're cooling the athlete. So just to hit on the wet bulb globe temperature. So this is what we do to help us know if it's safe conditions to practice. These charts are region specific, since we know it gets hot, and a lot of people like to say, oh, if we went by this, we'd never get to practice, but it keeps the athletes safe, and there's ways that you can work it to your advantage and to practice safely. So the green is less than ideal, but we're still good to go. Maybe take a few more water breaks. And then yellow, increased risk, so keep an eye on those players that you know are at increased risk for heat illness. Football, we're going to remove some of our equipment. And then red means we're at high risk, so we don't want to practice more than an hour. We want to make sure that we're taking water breaks and that we're not practicing with our equipment on. Now once we reach, say we started practice and it was green and then we get to red, we'll keep checking it. And if we go back to a point where we can put our pads on, we'll do that. So it's not like once you get to red, you're stuck there the rest of the day. So some things that you can do just to be strategic and try to still get practice in when it's hot and it's lightning. Consider maybe doing a study hall, feeding the kids first and then practicing. I know most of the time, about 4 o'clock, we don't really have any more heat issues. It helps if you do all the first part of your practice without full pads, and then wait till you get to team to put all your equipment on. By the time you get there, usually you're at a place where it's okay to wear all your equipment. And then consider your preseason practices in the evening instead of in the mornings, because it's getting cooler in the evening. And our goal is not to keep you from practice, like Kim was saying. We want to be out there and get it done too. We'd much rather be outside watching practice than inside watching the weather or inside monitoring the heat. It's not fun for us either. We want to be out there practicing just as bad as you do. So we don't want to keep you from that. We just want to make sure that we're keeping our athletes safe and going about practice in the best possible way. It's important not to forget about the summer when we're not around as much. The county has given you all access to these tools, the wet bulb globe and the cold tubs, and so you have those tools to use even when we're not around. So make sure that you're keeping an eye on those things and having that prepared for the athletes. It's still important even when we're not around. So one last thing to touch on, may have heard of rhabdo or exertional sickling. This happens with sickle cell trait. So athletes that have sickle cell trait, within the first 30 minutes or so of practice or overexertion, you might see them start to have issues. They can't catch their breath. It may appear that they're cramping. One way to know the difference between just muscle cramps and the sickling is, if you ever see an athlete have a muscle cramp, you can take their calf and you can feel the muscle cramping. In the case of sickling, you don't feel that muscle tightness. So that's one thing to be aware of. And also, the way to tell between that and heat illness is that their core temperature is not greatly elevated with rhabdo. This is also a medical emergency where you would want to activate your EAP. And one more thing, I forgot to mention this yesterday, but return to play guidelines after heat illness. So if they do have a heat stroke, a note from the ER is not sufficient for returning to play. Discharge papers from the ER. They would need to follow up with their primary care, and they need to make sure that all their blood work and everything is back to normal before they're going back to participation, and it would be a gradual return to play. So there's no set timeline. It's going to be specific to the athletes. You just have to work with your athletic trainer and physician to return them back to play. And with that, Amanda's going to come up and talk to y'all about some general medical conditions.
All right, we're almost finished, guys, so hang with us. So some general medical stuff. You want to review your physicals before each year or before each season. Going over, checking if your athletes may have asthma, diabetes, any allergies that they may need an EpiPen on hand for. Sickle cell trait is what Jessica just talked about. Any prior heat illnesses, hyperhidrosis, solitary organ issues, disease, and any previous surgeries that may inhibit their participation. Your athletic trainer usually goes over these, so when we send out saying, hey guys, send us a roster, this is what it's for, so that we can go over and pull each physical and make sure that we can check all of this. So make sure you're sending your rosters to your athletic trainers. Some general medical stuff for just good knowledge is if your athletes have any kind of sickness or illness, any kind of fever, they really shouldn't be participating that day. If they have a fever, it could be something else going on that they may need to go see their doctor for, such as mono. And then skin infections are a big concern in weight rooms and gyms. Making sure that you're keeping your gym clean, your weight room clean. The county provides a good disinfectant spray. You just get with your janitorial service and they will give that spray to you, and we try to spray our stuff down at least once a month. I know usually I'm the one spraying everything. And then someone cleans our locker room for us every day. And then making sure that you're cleaning your equipment too. So I like to keep Lysol on hand or that disinfectant spray, and I can spray my helmets down, spray my shoulder pads down. Sometimes the kids come to me and it's like, I can't wait another day. You got to spray it today. Because that will help also prevent any kind of infection.
And then washing your stuff every day too will help. Making sure that your kids are cleaning, and if they don't have the means to shower, maybe you can help them out with that too. So a big issue, well, our number one killer for high school athletes is sudden cardiac arrest. It's good to be knowledgeable about this and how to treat it. It's the leading cause of death in young athletes, predominantly male athletes, and African Americans make up 52% of this. 67% of cases happen during football and basketball season. This is when your EAP is going to come into play. And within our coverage area, we've had 3 incidences in the last year. So that's kind of a lot. Some warning symptoms are going to be exertional chest pain, exertional syncope or near syncope, which is fainting, unexplained seizure, excessive shortness of breath, disproportionate fatigue, and irregular heartbeats. So this is always when you activate your emergency action plan. So recognizing the situation, anyone that collapses and is unresponsive, you assume that's a sudden cardiac arrest until you're proven otherwise. They may have a seizure-like activity or agonal breathing. Agonal breathing is not normal breathing, so that's when you're going to start your CPR, get your AED. Of course, call 911 first. Don't be scared to just make the call before you know what's going on. You can always send 911 home if you don't need it. So preparing for this, you want to have some coaches, and of course your athletic trainer is CPR and AED certified. If you can get a couple coaches that are also trained, that will help the athletic trainer out, or if your athletic trainer is not on staff, maybe you have a late practice or an early morning practice, your athletic trainer is not there, you may have an event happen, so if you're CPR certified, you can at least help this athlete out. Our goal for getting your AED on the patient is 1 minute from collapse to shocking with the AED. So that means you're running to grab the AED, getting it on your patient within a minute. So if you can get your team together and say, hey guys, if something was going to happen today, Little Johnny, you're going to get the AED, and hope Little Johnny doesn't pass out. Make a secondary. Your survival rate declines 7 to 10% per minute after the collapse. And then with CPR, if you can be doing CPR before you get the AED on them, you're going to increase your survival rate about half of that. So the AED is not going to shock them unless it's appropriate. So don't think, well, if I put this on them and it's not a heart issue, then it's going to shock them anyways. It will not. It will detect their heart rate or their heartbeat and then shock them if appropriate. Okay, so concussions. We're going to do a little true or false. You have to hit your head to sustain a concussion. True or false? Good. CT scans and MRI diagnose concussions. Good. False. That was a little light. Y'all didn't answer very loud on that one. A concussion is a serious head injury. Good. I heard false. Somebody's class clown. All right. Concussions are graded from mild to severe. False. So we don't grade concussions anymore. Concussions are based on the patient. So just because we both hit our head at the same time doesn't mean that we're both going to have the same issues after we're diagnosed with a concussion. It's graded. It's not graded at all. It's just we're going to treat you according to your symptoms. Concussion symptoms may not appear at time of injury. True. Good. So sometimes we can have symptoms after 24 hours. The patient comes in the next day and says, hey guys, I got a really bad headache. I'm not sure what's going on. And that's whenever we want to assess them for a concussion and see where we need to go from there. All right, so what is a concussion? Sports-related concussion is an injury to the brain as a result of a force. And it may not be from a direct blow. You can have like a whiplash effect that can also cause a concussion. Symptoms may be sudden or appear over time, and then it's a functional disturbance that is not visualized on imaging, because you don't always have a brain bleed with a concussion. That's what your CT and your MRI are for. So prevention, Unfortunately, helmets, headgear, any kind of headgear, mouthpieces, face guards, and helmet sensors are not going to prevent your concussions. They don't always detect either, the helmet sensors. You want to make sure that they're still wearing these things because it's going to prevent other head and facial traumas, but it doesn't always protect the kid from having a concussion. So how can we prevent? The key is to working together to provide concussion-specific training and improve knowledge of sports-related concussion. You want to be able to identify these things, report them, and treat in a timely manner. We don't want to just brush it under the rug and not talk to the kid about what we need to be doing, or to your athletic trainer about this kid's concussion. It's important to review their physicals and know which athletes have a history of concussion also. So when should an athlete be removed from play? Anytime they have symptoms or signs or behaviors consistent with a concussion, they should be removed from the practice or competition. Of course, when in doubt, sit it out. It's a good slogan for everybody to remember. They cannot return to play the same day. We'll kind of talk about the protocol in the next slide. And just be familiar as a coach with your signs and symptoms. If you do the FHSA coaches class that's online, you'll get a good understanding of what you need to be doing. Any symptoms, then they need to be referred to their athletic trainer and then further to their physician. It has to be an MD or DO. It can't be a nurse practitioner or a PA, so they can't go to the Minute Clinic for this. A lot of times the urgent care has a PA there as well. So we need to make sure that we're getting these patients in with their athletic trainer to help facilitate that appointment. And then if you don't have your athletic trainer on staff, maybe you can get them in with our primary care doctor, or we have physicians over at Andrews that would be glad to treat your athlete with the best care they can get. Communicate with their parents. Have a parent meeting during the preseason. It's a great way to give a quick overview about your concussion protocol and how they're going to be treated. The process is usually smoother when parents know about the policies, and be upfront with your parents about the management of concussions so they're not caught off guard whenever you have that instance happen. Per the FHSAA, students must be cleared and evaluated by a physician, MD or DO only. And then the AT-18s, we need to keep those on file for 7 years. I know our policy now is that any athlete that we treat for a concussion, their return to play has to be sent to your athletic director. So if you need a copy of that, just get with your athletic trainer. She can CC you, she or he can CC you on that student's AT-18. But we do keep it on file too at our office. So here's a little bit of the first part of the protocol. We want the patient to go through a full day of school before they are starting the active part of the return to play. So they're having no symptoms, then they go back to school, they do a full day of school, and they're having no symptoms with a full day of school. Then the next day is when we want to start our protocol. And you guys are probably familiar with this part as well. It's a 6-day protocol. First day is the symptom-free day for 24 hours. The second day is a light aerobic exercise. The third day is sport-specific exercise, fourth day is non-contact, and fifth day is a full practice. And so day 6 is when the physician's going to review it and sign it, and then hopefully send it back to the athletic trainer as quickly as possible, because we know y'all want to get them back out on the field. So as long as this patient's not having any symptoms between day 1 and then day 2 and day 3, they're 24 hours symptom-free and able to complete the protocol, then we will be able to move on to the next day. If not, then say they have, with light aerobic exercise, they have a little headache afterwards. We're going to go back to that the next day. We're not going to move on to a new day. We're going to go back to light aerobic exercise and try that again. As long as they have no symptoms, then we'll be able to move on to the next day. You guys are kind of spoiled because your athletic trainers usually take care of this for you. But if you're responsible for it, especially during the summer, or maybe your athletic trainer's out, or like Laurel Hill, you guys are the number ones over there. Y'all have to take care of those athletes, and we'll be glad to help you with that, of course. And I think we're on to Kathleen.
All right. So a few quick wrap-up things. I want to thank my team again for presenting all this info to you. I hope that you didn't learn everything new. I hope that wasn't groundbreaking information, like I said, but I do hope you got some takeaways that can help you feel more prepared for these things that may happen at your school. Hopefully not, but better to be prepared than not. And certainly for us to work effectively together. So I want to take just the last few minutes here to tell you about a few additional services and resources that we're proud to be rolling out to you guys, or things that are already existing as well. So quick reminder on the neurocognitive baseline testing. As was mentioned by a few here, this is a tool that helps us accurately analyze and measure neurological and cognitive deficits that may exist following a head injury. So this is not diagnosing concussions, but it's a helpful tool, another tool in our toolbox to help feel that we're making the right decisions for return to play. So if a student athlete does sustain a concussion, where this is valuable is once they are self-reporting that they feel better, no symptoms. Hey, I haven't had a headache, I'm not dizzy, I'm not on medication, I'm feeling good. So then we just let them go, or do we do some testing? So that's really the value in this service there. Being able to offer that is important to us as well. So that is performed before the sports season. We want to make sure we have a good testing environment in that, especially as we're performing those baselines, but also then repeating. And here's the requirement component, that second bullet point there. As far as the C3 logics with us, it is optional. You don't have to do it, your student athletes don't. But for Okaloosa County, they want to have one of the three following things on file and valid each year. C3 logics, that would be through us. Impact testing assessment either through the school, or a signed declination form from that's the county form for the student athlete saying they just declined. They've been offered it, they understand that, and they're declining it. So if you got questions about that, let me know, or Brian, either way. But that's no changes really on that. That's the way that's been previously. So if you can, we really appreciate it if you can have one of yourselves, one of your coaches per sport at your team's time slot. It just helps us. You have a little bit of crowd management there. They listen a little better, a little more calm. Although sometimes I've been there and some of the coaches actually get them rowdy. So don't send your rowdy coaches. Send your good ones that keep them in line. But that's a little bit about baseline testing. CPR and AED training, I believe, was mentioned earlier, but with advanced planning, we definitely can provide CPR and AED training to coaches and staff. We want to do this. We're excited to offer this. You've got a couple of your athletic trainers are certified instructors with us as well. So we're Matt, Amanda, Jessica, and those folks can do it. And we have a few others as well who can participate in that. That is something I just want to let you know. If you have an interest, let us know. Let Brian know on that for sure. I just really appreciate your time and attention as we talk through this stuff that's very important for all of us. And thank you for allowing us to care for your student athletes in your community. We're proud to do it. And does anybody have any questions about any of that baseline testing? Anything I can answer right now? Definitely not. Okay. Thank you guys. Really appreciate it.